Welcome to NSG 323, Study Session 6, Retroverted Uterus. Introduction. A retroverted uterus is the name given to a uterus that is tilted backwards inside of the pelvis. Normally, women are born with a uterus that is located in a straight up and down position inside of the pelvis, or with a uterus that tips slightly forward towards the stomach. However, some women have a uterus that tilts backwards, pointing towards the spine, commonly referred to as a tipped uterus. This condition affects more than 20% of women worldwide. Generally associated with no health complications, a retroverted uterus can occasionally cause painful symptoms or signal an underlying health disorder. The vagina is not vertically positioned inside the pelvis. It is slanting towards the lower back. In most women, the uterus is tilted forward so that it lies over the bladder with the top towards the abdominal wall. Another normal distinction found in some women is the upright uterus, where the fundus is straight up. 1 in 4 women has a retroverted uterus. This translates to the uterus being tipped backwards so that its fundus is aimed toward the rectum. Some women experience symptoms including painful sex, even though a retroverted uterus does not cause problems in most cases. Learning outcome. At the end of this study session, you should be able to define a retroverted uterus, list symptoms of a retroverted uterus, outline the causes of a retroverted uterus, list the effects of a retroverted uterus. Definition of retroverted uterus. A retroverted uterus, tilted uterus, tipped uterus is a uterus that is tilted backwards instead of forwards. This is in contrast to the slightly anteverted uterus that most women have, which is tipped forward toward the bladder with the anterior end slightly concave. Between 1 in 3 and 1 in 5 women, depending on the source, has a retroverted uterus, which is tipped backwards towards the spine. Other names for retroverted uterus include tipped uterus, retroflex uterus, and uterine retro displacement. A retroverted uterus is not believed to affect a woman's fertility. In most cases, a retroverted uterus doesn't interfere with pregnancy. The vagina is not positioned vertically within the pelvis. It is angled towards the lower back. In most women, the uterus is tipped forward so that it lies over the bladder with the top fundus towards the abdominal wall. Another normal variation found in some women is the right uterus, where the fundus is straight up. A retroverted uterus, tilted uterus, tipped uterus is a uterus that is tilted backwards instead of forwards. About 1/4 of women have a retroverted uterus. This means the uterus is tipped backwards so that its fundus is aimed toward the rectum. While a retroverted uterus does not cause problems in most cases, some women experience symptoms including painful sex. The vagina is not positioned vertically within the pelvis. It is angled towards the lower back. In most women, the uterus is tipped forward so that it lies over the bladder with the top fundus towards the abdominal wall. Another normal variation found in some women is the right uterus, where the fundus is straight up. A retroverted uterus, tilted uterus, tipped uterus is a uterus that is tilted backwards instead of forwards. Symptoms of a retroverted uterus. A pelvic exam will show the position of the uterus. However, a tipped uterus can sometimes be mistaken for a pelvic mass or a growing fibroid. A rectovaginal exam may be used to distinguish between a mass and a retroverted uterus. Generally, a retroverted uterus does not cause any problems. If problems do occur, it will probably be because the woman has an associated disorder like endometriosis. Symptoms and causes for a retroverted uterus. Painful sexual intercourse. The woman on top position during sex usually causes the most discomfort. Period pain, particularly if the retroversion is associated with endometriosis. Lower back pain. Increased number of urinary tract infections. Incontinence. Pain while using tampons. Fertility difficulties. Some of the causes of a retroverted uterus include 1. Natural variation. Generally, the uterus moves into a forward tilt as the woman matures. Sometimes, this doesn't happen and the uterus remains tipped backwards. 2. Adhesions. An adhesion is a band of scar tissue that joins two usually separate anatomic surfaces together. Pelvic surgery can cause adhesions to form, which can then pull the uterus into a retroverted position. It may also result from endometriosis, pelvic inflammatory disease, salpingitis, pelvic surgery. 3. Endometriosis. The endometrium is the lining of the uterus. Endometriosis is the growth of endometrial cells outside the uterus. These cells can cause retroversion by gluing the uterus to other pelvic structures. 4. Fibroids. These small, non-cancerous lumps can make the uterus susceptible to tipping backward. 5. Pregnancy. The uterus is held in place by bands of connective tissue called ligaments. Pregnancy can overstretch these ligaments and allow the uterus to tip backwards. In most cases, the uterus returns to its normal forward position after childbirth, but sometimes it does not. Weakening pelvic ligaments associated with menopause may cause this condition in women who previously did not have a retroverted uterus. Effect of a retroverted uterus. 1. Sexual problems. In most cases of retroverted uterus, the ovaries and fallopian tubes are tipped backwards too. This means that all of these structures can be booted by the head of the penis during intercourse. This is known as collision dyspareunia. The woman on top position usually causes the most pain. It is possible for vigorous sex in this position to injure or tear the ligaments surrounding the uterus. 2. Fertility issues. It is thought that a retroverted uterus has no bearing on a woman's fertility. 3. Retroverted uterus and pregnancy. In most cases, a retroverted uterus does not interfere with pregnancy. After the first trimester, the expanding uterus lifts out of the pelvis and, for the remainder of the pregnancy, assumes the typical forward tipped position. In a small percentage of cases, the growing uterus is snatched on pelvic bone, usually the sacrum. This condition is known as incarcerated uterus. The symptoms usually occur somewhere between weeks 12 and 14 and can include pain and difficulties passing urine. Diagnosis of a retroverted uterus. A retroverted uterus is diagnosed by routine pelvic examination. Sometimes, a woman may discover that she has a retroverted uterus during a pap test. If you are experiencing symptoms such as painful sex, the first action taken by your doctor may include a range of tests to find out if other conditions are causing your retroverted uterus, such as endometriosis or fibroids. A pelvic examination reveals the position of the uterus. However, a tipped uterus can sometimes be mistaken for a pelvic mass or an enlarging fibroid. A rectovaginal exam may be used to distinguish between a mass and a retroverted uterus. An ultrasound examination can be used to determine the exact position of the uterus, if necessary. Treatment for a retroverted uterus. If a retroverted uterus is causing problems, treatment options can include 1. Treatment for the underlying condition, such as hormone therapy for endometriosis. 2. Exercises. If movement of the uterus isn't hindered by endometriosis or fibroids, and if the doctor can manually reposition the uterus during the pelvic examination, exercises may help. However, the medical profession is divided over whether or not pelvic exercises are worthwhile as a long-term solution. In many cases, the uterus simply tips backwards again. 3. Pessary. A small silicone or plastic device can be placed either temporarily or permanently to help prop the uterus into a forward lean. However, pessaries have been linked with increased risk of infection and inflammation. Another drawback is that sexual intercourse is still painful for the woman, and the pessary may cause discomfort for her partner too. 4. Surgery. Using laparoscopic keyhole surgery techniques, the uterus can be repositioned so that it sits over the bladder. This operation is relatively straightforward and usually successful. In some cases, the surgical removal of the uterus, hysterectomy, may be considered. Summary. In this study session, you have learnt the definition of a retroverted uterus, the symptoms of a retroverted uterus, the causes of a retroverted uterus, and the effects of a retroverted uterus. Also, you have learnt the treatment for a retroverted uterus. End of study session 6. Thanks for listening.